So let's talk about a kind of quandary that people sometimes find themselves in. So you have limited space in your hospital. You have some different people come through the door. You have to decide who to give bed to. Now, of course, if you're able to kind of squeeze people in, you bring in everyone, right? But if you can't realistically squeeze people in and give them the care that they need, you have to start making those really tough decisions. So let's say you have a patient who comes in and they're in really rough shape. So if you don't bring them into the hospital, they're almost certainly going to die. But here's the thing. If you bring them into the hospital and throw everything you've got at them as far as resources, they still might die, right? You have another patient who comes in and, they're sick. They need help. But if you turn them away, there's a decent chance they'll be able to recover outside of an inpatient setting. But you're pretty sure if you do bring them in, they'll almost certainly be okay, right? So that's the sort of decision that starts getting tough if you focus on the most needing patients. You may end up spending a lot of time and energy and resources helping people who are perhaps going to die anyway. Of course, it's an uncertain world. We don't know who is going to live and who's going to die. But medical professionals have evidence and experience and training that gives them a pretty good sense of some of these things, in some context anyway. So who do you favor? The really sick patient who definitely needs your help, but you may not be able to save them anyway? Or the patient who's sick and you'll definitely be able to help them. There's a chance they do okay even if you turn them away, though. That's tough. That's using scarce resources to the best of your ability. That's kind of a core economic activity that we do, right? Economic activity in the sense of things that we do as economists. We have an objective function and it has constraints, and we maximize or minimize our objective function subject to the constraints. And so here we're trying to provide as much good as we can, maximizing the healthcare benefit we can provide to patients subject to the constraints on the number of beds, the staff, the ventilators, whatever it is that we need to be able to care for people. And it's not always clear what that means. And so one of our readings this week is to look at a joint statement from a bunch of medical associations, the American Medical Association, Nurses Association, a whole list of them, that addresses some of these issues, not in an in-depth way, but talks a little bit about if you're a healthcare provider, you're supposed to have a plan for how to think about these things. But if you don't have a plan, it gives some kind of rules of thumb, or at least guideposts, things to be thinking about when you're making these really tough decisions. And so that's something I want you guys to spend a little bit of time with, looking at what these medical professionals, what the associations are putting out as kind of a quick guide for healthcare professionals who find themselves in really tough spots, and use it to think about the moral issues that come up in this healthcare system that we have, with all healthcare systems. No matter what system you're in, there are scarce resources, and these things can come up, and at times, unfortunately, do come up.